So I appreciate you guys being here today. I think it's going to be an opportunity for us to take it back to the beginning. So COVID, you know, I want to put you guys in the right state of mind. We're talking March 2020. We are steady trying to find a new clinic site, and then bam, COVID-19 comes into our picture. What do you guys remember about that?
We didn't know what we were facing. A lot of uncertainty. I remember calling you. You were on your time off and vacation, and we needed to call to executive meeting ASAP. We all got together, and then we, at the same time or the next day, I don't remember exactly the day, I have most of the dentists get the dentists and dental staff take the ADA letter saying that, you know, they can provide services and so forth. But as a federal clinic, we have to provide services for emergency services and so forth. So we discussed with them, we give them a chance to protect their families and so forth. And about 25 to 30 people altogether decide to go home.
Yeah, so now we're SCIM crew, if you guys remember, and we're over here saying, well, we have to do COVID testing. We have to do something for the community to tackle this pandemic. So those that decided to stay, we have a meeting to discuss, right, implementing COVID-19 and how are we going to keep our staff safe. And
correct.
So what was some of the funnier things that we did?
Well, at that point we got together, and first of all we decide, you know what, even though most of the private clinics at that point just closed the doors, they closed the door completely, so there were even some, a lot of clinics closed the door, let's put it like that. Families together take that decision with the support of the board and the executive team to stay open and to be for our community, because that's our call. So then of course we're going to provide testing, right? So I talked to Dr. Schwartz, you know, we're going to do testing. He said, what? Yes, we're going to do testing. We have to do testing. That's our job at this point, to do testing. Well, how you're going to keep me protected? Well, let me think about it. And then we start drawing, you and I, and with some of our construction people, we draw, you know, some acrylics with some wood and some wheels and so forth. So we come out with this design. Now you're seeing all around, but at that point, I don't know if we were the inventors of this design or not.
We potentially left money on the table, I have to tell you.
I don't know, we should have patented it, but anyway. But we presented to Dr. Schwartz, you know, and then have 2 sticks here so we can go to the cars with 2 holes here, go in there, do and come up and say, yeah, I can do tests with this. So we did 4 of those, and then we start with the testing.
And then in a month's time, I mean, we had to get all the protective gear, Isabella, right?
Wow, that was a challenge. We were having a hard time finding gowns and gloves. We couldn't find any, while our suppliers raised their prices tremendously.
Tremendously. I mean, 3 times, 4 times the price of gloves and so forth. And also, more expenses, no income. We didn't know we were going to get paid. The county of Orange wasn't clear about the funding, how it's going to be. We were doing like 200 tests a day, having staff doing their jobs without knowing if we were going to do that. A lot of clinics actually, not a lot, some clinics left the testing business because they didn't know if they were going to be able financially sustainable to keep providing those testing.
So no reimbursement. Uncertain about whether we have the protective gear, but yet our teams went out there every single day, 300 tests a day. We were providing these COVID results to the community.
Drive-through.
Drive-through, pretty incredible. So then moving forward, about a month in, we do over 10,000 tests. Now people are starting to perk up their ears. The county is saying, okay, Families Together is doing great work. Let's invite them to participate into the cohort of health centers that are going to tackle the most hardest hit communities in Orange County. So now our mobile unit is out there in school sites, and I'll share a quick story of me waking up, no sunlight, it's 4 in the morning, me and Parcia, by the way, what a hero, right? And we'll talk about him in a second. But we go out there, no sunlight, setting up all these canopies, the mobile unit, and there is lines already at 4:30 in the morning, people there to get COVID tested. I mean, talk about that for a little bit.
I know, it took incredible amount of work, organization, structural, for us to be able to do that. And I'm so proud that families together step up to the plate, and with partners like the Coalition of Orange County Latino Health Access and all that, we were able to provide all these services. But it took a lot. It took a lot of work, a lot of organization.
We had lines around the whole block, going 2-3 blocks out. We had cars with 4 or 5 people inside. All families getting tested, worried. We had each patient was registered into our system, consent signed, and then they all saw a provider counseled each person. You know, you'll get a phone call in a couple of days. If you get the symptoms, you'll be doing this, and just, it was amazing.
It was a major leap.
Yes.
Major leap.
Yeah, comprehensive in its totality. So then about a month later, now we're talking May 2020, maybe June 2020, the reimbursement starts kind of rolling in. So now everybody wants in on the business, right? It gets inundated, and then the labs aren't prepared to receive the pent-up demand. So all of a sudden we're sending in tests, and we're now receiving results for 2 weeks after for the patient.
For a period of time, yes.
And so we have angry patients. What else?
Angry patients, nonstop phone calls.
Yes, remember, I mean, our phone lines got so crowded. I remember one time I started checking the messages from 8 a.m. to 9 a.m. I have 800 messages.
Yes.
800 messages in just 1 hour through the day. The lines were just completely overwhelming. It was just crazy times.
But we stayed on our toes. We pivoted to another lab, you know, and we were able to get those results in a more timely manner for our patients. And, you know, yet another example of how Families Together didn't stop just because there was a barrier in the way.
We hired providers just to give results.
Yes.
You know, that was extreme, I think, from Families Together. We took patients that we were not their primary care providers.
The primary care office were closed. Yes. You know, they were closed. We were, I mean, to be quite honest, at that point, I will say that it was at least 30% of the patients that we were seeing were not patients assigned to us.
Right. And that's incredible. I mean, we're still lifting, getting their prescriptions refilled, all that good stuff.
The follow-up phone calls to see if they're having any symptoms, if they're feeling better. It was amazing.
So we hit middle of summer, we hit the milestone of 20,000 COVID tests. And then the narrative starts to change, if you guys remember a little bit, right? I mean, people were donating signs, you know, a hero lives here, yes, you know, kind of stuff like that. And then around midsummer, they're like, no, COVID's fake. You're the perpetrator of fear. What are you guys out here still doing COVID testing? Cussing, you know, what you mentioned a story about cars passing by.
Cars passing by our drive-through center yelling at us, you know, it's not real and so forth. It was crazy. I mean, Parcia, like we said, a true hero. They used to give him pizza with nice comments and little papers and letters, and then they were just casting him out. It was just crazy. But through it all, Families Together and Families Together team just continue to provide the services.
Yeah, and even through that second wave, right? I mean, it used to be that you didn't know anybody had COVID, and then in the fall months of 2020, I mean, we're talking October, November, December, it was like, no, my brother, my sister, I myself am getting COVID. And so now the fear was back, and it was there, and we continue to do testing. And I can say to this date, we've done over 20,000 COVID tests for the community. And I think that that's an incredible milestone.
We continue to test.
And we're continuing to test. Around that same time, we also started to get the talks of the vaccines, right? December.
Yes. December 28th, if I remember correctly, we got our first shipment of vaccine. I think it was like a 200 or 300 vaccines, very limited amount of vaccines that we got at that point. And Dr. Gordon, our medical director, actually got the first vaccine. I was out of town, so he actually beat me to it, but you know. Yeah. But we start vaccinating, of course, our employees. We vaccinate how many health centers?
Oh, 7, 8.
7, 8.
Their whole staff.
Their whole staff lining up here and so forth. It was nice.
We were the first ones, I think, that got the ultra freezer. Remember how you jumped right on it?
Yes, the ultra low freezer. Yes. Yeah. Yes. Our board is incredible. I just called the president and said, you gotta have an ad hoc meeting. I need to buy this ultra low freezer, you know, now. I said, go for it.
Which put us at the head of the pack. I mean, that's why we were recognized and we were given vaccines.
We were the hub for 6 other nonprofit clinics. You know, that's amazing that we were able to receive vaccines for them and then have them come and pick it up from us, and we stored it for them.
Yeah, now with the vaccines come another workflows, another, you know, so many different new additions that we needed to do.
Yeah, higher security, to rechange the layout of the wellness center. All of a sudden, we were waking up at sunrise, but for a totally different thing. It wasn't COVID testing, it was COVID vaccines. Lines out the door, right?
Oh my God, rain or shine. We saw patients in the rain, we vaccinated in the rain, we tested patients in the rain, and then in the summer we tested in patients and did vaccines with fans because it was so hot.
Yeah, and some of the big parks were closing because of weather elements and so forth. Yes. We didn't. I remember holding out a couple of the tents because they're having a really strong winds and so forth. So it's been amazing, to be quite honest.
And it seems like we just didn't know when enough was enough. We kept biting and chewing, you know, biting more than we can chew, but gladly, right? So then our mobile units start going out. February of 2021, a few months ago, and so we're out there with partnerships like the city of Tustin, with schools, with shelters, and we're providing vaccines for them.
We've been able to vaccinate about 250 restaurants of Tustin, plus now we're doing it with the city of Orange as well. I'm proud to report we vaccinated over 3,000 teachers. The Tustin Unified School District have about 2,500 teachers. We vaccinate 2,000 of those teachers.
Well, we just vaccinated 800 some people in
and the
school.
pop-up event, that's the largest.
Pop-up event.
Yeah, the largest non-pod related pop-up event for COVID vaccine.
That is correct. So,
and today we've done 35,000, right? 35,000 top 7, right? Consistently. And going, right? So whoever number 6, we're coming for you.
And I think what was and what's amazing is that we have Pfizer, Moderna, and Johnson.
Correct.
I mean, we were able to offer all 3 brands to all our patients.
Yeah, according to the County of Orange, we have been top 10 vaccinators for a while. I mean, since we started looking, which was probably 3 months ago, but who knows how long that has been. But yes, it's been all right.
Definitely. And so as we kind of now look towards a post-COVID, you know, arena, what do we do now? What happens after vaccines?
Well, I actually will bring us back to the beginning, right? So before COVID, we had plans. Our wellness center was flourishing with acupuncture, physical therapy, wellness kitchen, and so forth. So now we need to go back to that. And that's what we actually been planning the last couple of weeks. We've been planning on approaching the reopening of the wellness center. Well, you're the director of programs, so you know all about that.
Yeah, and Isabella can echo a little bit too, that clinic operations throughout this whole thing, we never stopped. We were still providing primary care, we were still providing OB, right?
Pediatrics, we had newborns, we had parents that were scared to come in, and we had to bring them through the back door straight to an exam room with our newborn children. Yeah. Our providers continued to come in.
And now one of our big concerns again, which as you both know, we have plans, we're working with Anaheim School District, Tustin School District. The children has been out of school. I mean, they're not up to date with their vaccines. So one of our main campaigns now is going to be vaccinating the regular vaccines, not just the COVID vaccine. We're talking about the regular vaccines to our children.
Right. So safe to say, Families Together is still hungry for more, even after this pandemic, right?
Definitely.
We've become Families Together to be for the families, and I believe our community is the most important thing that we can serve, and that's what we're here for. And we will continue to do that, whatever the need is, whatever the challenge is. You know, with the team that I have, I mean, just bring it on.
Just bring it on.
Bring it on.
And just to summarize, right, the whole thing of what we were able to accomplish, I mean, despite all the hardships, we're still here. We did our job. We came to work. When other people decided to go home, we came to work.
Correct.
And I think it's just an example of how Families Together can continue to be a leader in healthcare in Orange County.
We will continue to do that. Thank you. Thank you, David. Thank you, Isabella. Thank you to Families Together, to the community, to our partners, Coalition, Caloptim as well. Thank you.